Okay, so moving on to our next video, I'm gonna go ahead and insert my patient's NG tube. He's gonna be going down to pre-op soon. We've already got the Foley inserted, so now the doctor has ordered for the NG tube to be placed. I have all of my supplies. I've got my tape set up here. I've got my syringe and my water. I've got my pH paper. I've got a glass of water for my patient to have. I've got my basin. I've obviously got my catheter, and then I've got my suction that's connected to wall suction already. Okay, prior to me inserting the NG tube, I'm gonna go ahead and introduce myself to my patient, perform my kiwis, and wash my hands. So I'm gonna go ahead and put on my gloves. And I'm also gonna be performing an abdominal assessment right now. Prior to, I'm gonna go ahead and listen to my bowel sounds before inserting the tube. I know that if I have absent bowel sounds in any quadrant, I am going to have to listen to 5 minutes. So I'm gonna go ahead and start, and I'm gonna start in the right lower quadrant. I'm gonna go ahead and listen to my bowel sounds, listen to them for 1 minute. And I do have active bowel sounds. So I'm gonna go ahead and proceed with my NG tube insertion. Okay, now that I've got that done, I've already got my patient draped for the procedure. I've already let them know what we're gonna be doing and what the NG tube is. So now I'm gonna go ahead and get ready to start. My patient's been having some appendicitis and they've been feeling very nauseous because of it. So we're gonna go ahead and get the NG tube placed for surgery. I've got my lubricant and everything all set up here. So before I do that, I'm gonna ask my patient if he has any allergies. He doesn't have any allergies. I'm gonna also ask my patient if he's also had any nasal surgeries, because sometimes patients tend to have a deviated septum, which I've actually run into when I was helping a nurse do an NG tube, and we couldn't get the tubing in because the patient had nasal surgeries and their septum was a bit deviated and the anatomy of their nose just wasn't suitable for the NG tube. So because of that, I'm gonna ask my patient, which he has not. So now we're gonna go ahead and move on. I'm gonna go ahead and take my catheter out of my wrapper, and I'm gonna go ahead and get my basin ready for my patient. Before I insert the tube, I'm going to check it to make sure that it's not got any holes or anything in it, and I'm also going to be checking my suctioning. So I'm just going to go ahead, and I'm never using this blue port here. I'm going to go ahead and connect it to my suction and make sure it works. And it does. I'm also going to go ahead and just push about 10 mLs of water into here just to check to make sure that my catheter does work, and it does. So now that I know that, I'm gonna go ahead and clamp it back off, because when I insert it, I don't want it to, whatever I get back from the patient's abdomen, to come back out, okay? So now that all that's ready, I'm gonna let my patient, I've got some paper here just in case they need to blow their nose. So he's gonna go ahead and blow his nose. I'm gonna wipe his nose, and we're just gonna wipe the bridge of his nose off and discard that. So now that we've got that done, I've done my abdominal assessment. I'm gonna go ahead and get my catheter ready. My patient's got the basin, and I've got my pH paper here and the water. I'm gonna let my patient know that they're gonna be taking big gulps of the water as I advance the catheter down into their stomach. Okay, so now, before I go ahead and lubricate my catheter, I'm going to measure it. So I'm gonna go from, I like to go from ear to nose to xiphoid. So I'm gonna go from ear to nose, down to the xiphoid, and we are at 30. My catheter has numbers on it, so I know where to stop. So I'm gonna stop at 30, okay? Now that I've got that done, I'm gonna go ahead and lubricate my catheter. I'm gonna have my patient tilt their head up. They're sitting up, and we're gonna tilt our head up. Yeah, Mr. Teddy Bear. Okay. And we can go ahead and start. My patient's gonna have their water. I would have an assistant with me if possible, but my patient's 18 years old, so he's gonna be able to drink on his own. So we're gonna go ahead and I'm gonna compare the nares. We're gonna go ahead and put it into the right because the right nair is a little bit bigger. And we're going to tilt his chin up, lean forward, and we're going to go ahead and insert. So I'm gonna go ahead and insert into the nair, to the right nair. And I'm gonna keep going. If I feel some resistance, I would stop a little bit. And this I'm gonna have in my basin. I'm going to keep going until I hit the 30 mark. And once I do that, which I am, I'm just going to tape it one piece with one piece here, over here, just to hold it in place and check my placement. So now that I've got it inserted, I'm going to check my placement. I can do an x-ray, or I will also just go ahead and I can either pull back some of the contents of the stomach using my syringe. I'm gonna pull back some of the contents, and I'm getting, oh wow, I'm getting a lot. I got about 50. So I'm just gonna go ahead and discard of that, push that into my basin. I'm gonna go ahead and do it again. I got another 50. Before I push it all back into my basin, I'm gonna drop a little bit on my pH paper. I've got a pH of 3, so I know that it's in the stomach. Or I can also just go ahead and push in some air. And I can listen to the bowel sounds as I push in the air. So I'm gonna go ahead and do it that way as well. And then I'm going to, when I push in the air, I hear that it's in the stomach. So I can go ahead and remove that and remove this. Once I have that done, I can remove this tape, or I can keep it on, but I'm gonna go ahead and tape it using my pants leg tape. Just going to sit this on the bridge of the nose. Then I'm going to wrap one side around my catheter. Then the other side. There we go. Okay. And then I can go ahead and have an x-ray ordered. While I was inserting the catheter, my patient was taking his big gulps. I wasn't able to simultaneously say both, but he was taking his big gulps as I was inserting the catheter. And that's it for my NG tube. And after I did my abdominal assessment again, I'm gonna connect it to my wall suction. And now I'm done with my NG tube. Thank you.